Hi, welcome. This is the Benefits Consumer webinar for the Kinetic Health and Apex Benefits team. My name's Brandy Pardo, and I'm a Senior Account Executive here at Apex Benefits. One of my favorite things to talk about is benefits consumerism. So we're going to cover some of those items today. Thanks for joining. We're going to hit a couple webinar housekeeping. All attendees will be in listen-only mode for the duration of the webinar. For questions or comments, use the chat box located on the top of your webinar screen. For audio access, attendees can use the computer audio or call in using the phone option. Presentation slides and resources can be downloaded by clicking on the icon on the right-hand side of your webinar screen. All right, so what is consumerism and why is it important? Much like having a vehicle and getting maintenance on that just to keep up with everything, making sure that it runs and it lasts a whole lot longer than just a few years, you have to take it to get the tires checked and rotated, and you have to get the oil checked, spark plugs, all the things, the well check, just like you do for your own health care. But when we do this, being a good consumer means that we're calling around to finding the best deals on tires, to finding the best location to get those done, and the cheapest pricing that's going to suit our financial needs. Healthcare is not much different than that. So when we're talking about consumerism, it's taking those things that we need to get done and calling around to the best quality healthcare places at the lowest price that's best for our pocketbook and for our employer's pocketbook on the claim side. That way we're getting what we need in healthcare, but we're also being very conscientious of how we're spending those dollars. Today, I have a flyer that I am going to share with all of you. It's going to be in the link. It's something that I put together to help navigate good consumerism in healthcare. And we're going to walk through this flyer step by step and kind of talk about each section. Navigating good consumerism in healthcare. Navigating the complexities of healthcare costs can be challenging, especially when there isn't always a clear path or set of best practices to follow. So as we work toward reducing high cost claims and supporting our employer in managing overall healthcare spend, having the right tools and guidance is essential. The resource provided outlines the care options from the most cost-effective to those with the highest financial impact. By understanding these differences and making informed decisions, we can all play a role in keeping healthcare more affordable. Healthcare doesn't have to be so complicated. When you're equipped with the right knowledge, you're better positioned to make smart, cost-conscientious choices. So why is my role in keeping costs down good for the company that I work for? Well, self-funded or fully insured plans, the impact of my claims utilization will ultimately impact my organization's bottom line increases to the plan at renewal. So self-funded plans, what does that mean? Let's talk a little bit about the difference between self-funded and fully insured. Self-funded plans means that the plan sponsor or your employer pays a large portion of all the members' claims up to a specific individual deductible. Now, this deductible isn't like the one you pay out of pocket that could be $1,000 or $3,500. This is a deductible that they set as a limit to what they will pay. So it could be $50,000 or $100,000. Then after that, and only after that, the stop loss or the reinsurance carrier will reimburse the plan sponsor for anything above and beyond that deductible. And that deductible is an individual deductible. So each member on the plan, there's that $100,000 that the employee is saying they're going to be responsible for. And then after that, the reinsurance kicks in. For fully insured plans, That means that the plan sponsor or your employer is relying fully on the carrier to fund all the claims in hopes that the premiums that they pay to the carrier do not greatly outweigh the medical and RX claims paid out by the carrier. The higher that loss ratio is, the greater the rate is for increase at the renewal. I'm sure that was clear as mud. All right, so let's talk about green, yellow, and red. We all see this every day driving in our cars. Green means go, probably a good thing. Yellow, proceed with caution. And red, let's stop and think about what we're doing, why we're doing it, and how it's important. So, where can I get my care in the financial impact? Green, urgent, not urgent. Acute care, sickness, wellness exams. So, depending on your health plan and the facility available or access to care, here are the lowest costs suggested for acute care, sickness, and wellness. So, if you have clinic access, which means there's direct primary care through a clinic, anything that happens inside the four walls of that clinic, including medications that you may leave with, are usually $0 to the members. There's no cost for that. It's a direct contract negotiated directly with the employer who is paying the cost of that clinic. And there's no impact to the claims or the medical plan claims, which is a really good thing on the back end. Telemedicine. Here's another low cost or no cost employee for virtual visits with scripts called into local pharmacies. And the only thing the employee is responsible for is the cost of the medication that has to be sent to the local pharmacy. Now, keep in mind that if you call telemedicine, there could be a chance that the doctor on the other end of the phone isn't comfortable giving you a diagnosis or prescribing medication based off of what they see, and they may steer you towards an urgent care or an emergency room visit based off what you have going on. However, this is a great first stop for that check in with what's going on. How long have you been running a fever? The general questions that can be asked almost in triaging what you have going on before proceeding to where you may need to go. Keeping costs down, low cost or no cost. And then your primary care provider, of course, plan deductibles and copays or coinsurance may apply to you, the member. The claims do run through the plan, but the impact is minimal. $100 to $200 for that office visit is the average cost. Yellow, proceeding with caution. Urgent care. Urgent care needs are usually times that are in the evening or the weekends outside of normal physician office hours and clinic hours. We might also see a need for urgent care on minor injuries or accidents that don't require more extensive testing or treatment. So minor abrasions, small sprains. If you can't get into your doctor and you've been really sick, and maybe your doctor can't get you in for the next week, urgent care is now the next best thing. Again, it's a low cost. So urgent care access to these facilities and services are usually evening hours with some limited weekend hours. Average cost for an urgent care visit is $150 to $250 depending on the facility and the extensiveness of treatment. Most PPO plans will have a specific copay for this, which is nice to keep costs down for the members. And the high deductible health plans are always subject to deductible and coinsurance. Claims for this care, for urgent care, are run through the plan with some sort of member financial stated responsibility. The only other time we see that there is no pay for urgent care is if your employer group has a direct contract set up with an urgent care facility. And lastly, emergency room. It is in red, just to stop and caution. When a person has an immediate and emergent healthcare need, they're going to visit the emergency room. severe or an intolerable pain, major broken bones, severe lacerations, prolonged or very high fever. True emergencies at any time, whether self-transported or via ambulance, ER visits are for the most serious of health conditions. Most PPO plans will have a specific copay for this. Oftentimes, those are waived if you're admitted into for inpatient stay. High deductible health plans are subject to the deductible and coinsurance. Claims for all emergency room care is run through the plan with some sort of member financial responsibility. Average cost for ER claims can range anywhere from $1,500 to $10,000 or $20,000, depending on the care, the scans, or the tests that are run during this visit. All right, so on to something a little more light in topic. We're going to talk about freestanding imaging centers, surgery centers, and labs. This is another great way to keep costs down because all of these facilities are not associated with big hospital systems. So, a freestanding imaging center are facilities that are operated independently and are not affiliated with large hospital system. These centers are often provide price transparency tools online, allowing you to compare costs before scheduling your appointment. In non-emergent situations, you, as the patient, have the right to request a written imaging order from your provider and choose where you receive that care. This gives you the flexibility to select high quality, lower cost option. Choosing a freestanding imaging center can significantly reduce both your out-of-pocket expenses and overall claims costs, helping to keep healthcare more affordable for you and your employer. So at the bottom of the screen, you'll see Reyes Radiology, Northwest Radiology, and ProScan Imaging. These are just a few examples of freestanding imaging centers. Going to Northwest Radiology online, it's as simple as visiting the website. At the very top, there will be some drop downs for billing and insurance. If you click on that drop down and go into the billing and insurance page, there's actually an online estimator. This morning, I went in and did an online estimator for an examination of the chest single view. I think this is an x-ray to see what the pricing would be if I went in for an x-ray. So I put in my name and my date of birth, what scan I was looking for, and there was a drop down list of ton of options within the menu. And then once I populated that, it allowed me to download the pricing quote to give me an idea of what this was going to cost. Now, I'm currently on a high deductible health plan with a $3,400 deductible. If I went and got this scan today, it would cost $100. Now, I've not utilized any of my healthcare this year for anything other than wellness, which doesn't count towards my deductible. So my responsibility on that high deductible health plan would be that $100. Again, willing to pay this price, um, especially if the cost of this same procedure at a hospital system is $500 or $600. So it pays to go online and shop. Use the tools that are available to you to see what the pricing is before making a decision where to go. Again, these are things that you can do as the patient, asking for those orders and have the right to do as long as you're in a non-emergent situation. Freestanding surgery centers. Very similar to the imaging centers, you can do the same thing. If you go to the doctor and the doctor says, hey, I think you have a rotator tear and you're going to need to have surgery, the best thing you can do is ask the physician for the order so that you can call around and get some pricing on what it's going to cost to have the surgery done. We'd much rather know that way up front for scheduling that surgery of what it's going to be out of pocket before making that decision. So freestanding surgery centers are facilities that operate independently and are not affiliated with large hospital systems. I think I'm hearing a common theme. Like imaging centers, many of these facilities offer price transparency tools online, allowing you to compare costs before scheduling your surgical care. In some cases, these centers provide comprehensive care packages that may include recovery services, such as physical therapy or post operative care within the overall pricing, adding both value and convenience. For elective non-emergent procedures, you have the right as the patient to request a written order from your physician and choose where your surgery is performed. This empowers you to select a high quality, cost effective option. And last thing I want to talk about is the freestanding lab center. So these are facilities that perform lab draws and testing outside of the hospital systems. These centers often provide more cost-effective option for routine lab work. If your employer offers access to an on-site or partnered clinic, this can be an excellent resource for and may function similar to a freestanding lab for services such as blood draws or a venipuncture. In non-emergent situations, you can request the lab order from your physician and schedule your lab work at a location of your choice. The process is the same as having labs drawn at the hospital or the doctor's office, but typically at a much lower cost, and in some cases at no cost to you, the member. All lab results are sent directly to your ordering physician for any review and any necessary follow-up care. Quest and LabCorp are two of the ones that come to mind. If you have access to a clinic on site or near site, again, another option for free labs that you could have done. Here's an example of getting onto the LabCorp website. If you want to see what the pricing for the tests that they have available and the list of tests that they have available to you, you can actually go to the website and click on that button that says Shop Tests. Once the page pulls up, you can scroll down and there are numerous tests with different pricing depending on if you're male or female or what that pricing looks like. There's also reviews on those tests and how other members have facilitated and utilized these tests through LabCorp. So do your due diligence, do some shopping online, and see where you can't find the best high quality care at the lowest price for you and your employer. All right, so one thing that we get asked often when we are talking during open enrollment meetings, and this always comes up when we're talking about wellness and how important it is to get your wellness exam every year. It's important to get that colonoscopy or that annual wellness biometric screening. But we've had many people ask, I've been into a wellness exam before, and then a few weeks later, I got a bill. And why did I get a bill? So keep this in mind. Annual exams, while important for the early detection of major health related diagnoses, these appointments are specifically coded for wellness. While in those appointments, it's recommended that members keep the topics discussed to that of just wellness. Discussing additional ailments or any acute care things or concerns you might have going on can alter the CPT code assigned to the appointment to something other than wellness. So essentially, they put a new CPT code on because of the things that you've talked about, and now it becomes a diagnostic visit, and you get billed for the things that you've talked about in that diagnostic visit. So this may result in the appointment being billed in a different manner that copays, deductibles, and or coinsurance is applicable, which leads to a balance bill to you, the member. Now, again, if you get the bill from your physician and you know it was a wellness exam, make sure you're looking at the EOB on your portal or website for your carrier. And you, as the member, can contact your provider directly to let them know, I got a bill. This was a wellness exam. Why was it coded incorrectly? And then you can sweet talk them in, if you can, into changing that coding back to a wellness coding. If you run into issues or struggles, first line of defense is always going to be the care on the back of your card through your carrier. So if you're an Anthem or a UHC or Cigna or Encore, the number that's on the back of your ID card is the quickest way to get anything done. If you don't feel comfortable doing that, or you feel like you're getting in a long wait line on the telephone and not getting an answer, reach out to your HR, and your HR can reach out to broker assistants for help getting that resolved. All right. So, with everything wellness, talking about wellness, knowing how to be a good consumer, know that in anything that goes with healthcare, because healthcare is so complex, it changes on the daily. There's different ACA guidelines. There are different things that your employer group is covering this year than they did last year, that there are no stupid questions. Not asking a question at all so that you can be informed is probably the worst thing you can do. So reach out to your HR. They can reach out to the broker, reach out directly to your carriers, and those resources that are on the back of your ID card, maybe your pharmacy benefit manager if it has to do with your prescriptions. Contact your pharmacist, ask questions of your doctor so that you're getting the answers that you need to be the best consumer you can in your own personal health care. Those experts can answer those questions and then help guide you to where you need to go. Again, human resources and your insurance member services on the back of your ID card is your go-to. Well, I think we have plenty of time for some questions. If there are any questions or any comments that you want to post in the chat, we're glad to answer. No worries. We also have this wonderful guide that I talked about today that has your green, yellow, and red to help you with navigating healthcare. And on the back is going to be those tidbits in the freestanding imaging center, surgery center, and labs that you can utilize along with the tidbit on wellness. So make sure you download that, stick it on your refrigerator, or keep it handy at work just to keep a nice resource there for when you're needing healthcare. All right, so right now we have no questions, but if you do have some, please reach out to your HR, and I'm sure that they would be glad to filter that through us today. We appreciate your time and you jumping onto the webinar. We love to talk about all things consumerism when it comes to healthcare. Hope to see you at OE meeting soon. Have a super great day.